Well, I expect to find a spike in number of cases, but the main concern I have is our hospitalizations and the people who die from this. So this is my main concern at this point in time, because we're not testing enough to be able to know everybody who's been infected. The main thing for us at this point in time is to keep our hospitals free, so that if you have sprains and bruises and routine surgeries, you can still use the hospital. So that's the main thing I am focused on right now. We would expect to see a spike in cases. This virus thrives on human connection, as I said earlier on. So we would expect to see a spike in cases, given that we've had a big national holidays. And if I take you back to what happened last year, the Delta wave that we had, it's a different population now. First of all, it's a different virus, a different population, but the Delta wave that we had started 2 weeks after COP March last year.
Do you anticipate then we will be seeing more, is it more Pfizer vaccines within the next month or so, or is there a timeline, or are you just working on that?
As I mentioned earlier on, we're working with Government House and colleagues in the United Kingdom to get vaccines in. We expect to see them early in September, and we'll have a plan going forward on how to distribute that to the population. So September, we will be getting a new stock of vaccines. Most public health specialists and people who are in the know expect to have a spike this autumn and this winter. So this is why we're trying to protect people, give ourselves the best possible chance of getting out of this with minimal damage to our country and to our economy. And the best way to do this is making sure that you boost your immunity as much as possible. And we do that by getting the booster shots. So we expect to get Pfizer, we expect to get replacements for AstraZeneca for those who are unable to take the Pfizer vaccination. We also expect to have vaccines for children available from September. So all of that will be rolled out for throughout the country to make sure to give us the best possible chance going into the winter. We're also buying and ordering more oral antivirals that have been shown to be effective for this disease. I need to add quickly that oral antivirals is not for everybody. It's for people who are at higher risk of ending up in hospital. Those are the people who actually would benefit the most from oral antivirals. The injectables, the monoclonal antibodies, unfortunately, have not done as well with Omicron as they have with previous strains.